JB Medical. I want to just make sure that everybody's getting logged onto the web meeting. Is anyone having any issues? Everybody good? Okay, we're waiting for about 10 other people to join, and then we'll go ahead and get started. All right, so everybody should be viewing my screen. It'll say Dr.
Barely is starting.
Go at the top, and you'll actually see the Medisoft screen that you normally see. The things about revenue management is it's going to do a lot of things for your practice that helps you streamline your claims and prevent rejections and errors. So, but the things about your transaction screen and your claim management screen haven't really changed. So when you enter transactions here, that's pretty much the same process. So none of that has really changed. And then once you end, one thing I'd like to point out, because for some reason we are running into a lot of clients that are entering their charges, and they're actually printing claims down here to generate this claim. It's kind of a bad habit to do because, and you may have your own reasons for doing it, but just so that you know, when you print that, hit this print claim button at the bottom, it actually creates the claim number and puts those charges on a claim. But if you don't go over to the claim management screen and hit create claim, and you forgot to hit that print claim button at the bottom, that claim will never get generated and transmitted. So you want to be careful that you're not actually doing that or not doing it quite frequently. That should be a normal process. Okay? So I just wanted to go over that a little bit. You do have grid settings with these little black dots here where you can add things. As you notice on my screen, I've actually got a patient payment column, primary insurance, secondary insurance adjustment column. I can actually see payments that come in and dates that were created. So a lot of this stuff right here I've actually added to my screen. So you can do that by using your little black dot right here. And if you're not familiar with that part of the program, I encourage you to take the Medisoft Intermediate class that actually goes over that information. Okay, so coming over to claim management, either by the second icon right here or activities in claim management, we actually get into our claim management section. Now, I've got some claims that are ready to go EDI right here. And your claim management screen, when you hit the create claim at the bottom, it'll actually go out and it will grab any transaction line that doesn't have a claim number and that's not for a cash patient and it should be billed to an insurance company. Now, the things that you want to remember about this screen, and many people don't realize that this screen, they just kind of hit create and leave it alone. Your assigned indicator down here is actually telling the system to pull the claims and organize the claims by the provider on the case. So if you have one provider in your practice, it's not really a big deal whether you use assigned or attending. But if you have multiple physicians in your practice and you use their names to bill, you may want to actually use the attending because the attending actually pulls from the transaction line. So, and it will use that doctor's name to actually go onto the claim. So if you're having issues with revenue management, billing, tax ID, stuff like that, you might want to review in your claim management screen what provider you're actually billing with because you may have created the claims the wrong way. And many of you have been upgraded to version 17 from previous versions recently, and when that upgrade happens, it gets reset to assigned. So make sure that that indicator is correct for your practice. Okay, so I'm going to hit attendee, and I'm going to hit create. And it will go out and it will grab whatever claims don't have a claim number. Now, it pulls it in and assigns it to a claim number. When it pulls in the claims, it actually organizes it by life, facility, provider, and diagnosis code. So if for some reason you're getting your claims, you're getting two claims created for the same date of service, most likely it's because the diagnosis codes are not in the same exact order or they're not the same exact diagnosis codes altogether. So if you have that issue, really review what you're doing in your transaction screen. Okay, so I've got my paper claim. Your paper claim process hasn't changed. So the only thing that has changed that is when you upgrade to version 17 and you upgraded from a version prior to version 16, you do need to realign your claim forms. The provider screens have drastically changed and the field names have changed. So when you try to print an old paper claim, It's looking for a field that doesn't exist anymore when it comes to your NPI and your tax ID. So to align your paper forms, you're going to go to Report, Design Custom Reports and Bills. This part of the program has been around forever, so it hasn't really changed much. It's a very archaic, old part of the program, and it still needs to be there for paper claim alignment. And when I mean paper claim alignment, the forms that you have in your office, the physical paper forms you have in your office, that hasn't changed. But when you try to print a claim form, it's going to put the print on the form in a very specific place. Problem is, everybody's printers are different. They grab the form differently. So when you actually go to print the form, it's not going to align correctly. So you want to actually go into that area, click your open box, which is your second icon. You can come over here and filter out just insurance forms. And you want to use the primary form right here to align your primary forms, or the secondary form right here to align your secondary forms. And you simply open this up, and you move the boxes as you need to move the boxes. Now, if you need assistance with knowing how to do that, you can always make an appointment with one of our training staff, or we do have a reporting class that goes over how to align those forms easily. Okay, and then once you hit save, it's not going to let you override the system form. It's going to make you give it a new name, and so then you give it a name that makes sense to you. But the print, and anytime you buy a new printer, you're going to have to realign that form, because that form is really specific to that printer. But many of you have actually had many claim forms because you had different ways of batching out claims, and really you only need one form nowadays, because you have your provider PINs area that actually goes over the different ways that your contracts are laid out and the different MPI numbers and tax IDs that you would be billing with. Okay? So your paper forms haven't changed. You still hit print send, you still hit paper, you still choose the form and print the paper claim. Now, your electronic process, many of you got used to using this list only button. So you would hit the list only and you would filter out your primary ready to send claim. You can still do that, but revenue management kind of does it for you, because when you go to hit print send, it opens up revenue management's electronic process, and it will actually segregate just ready to send claims. So I'm going to go ahead and take that filter off. Hit apply. Okay, you also have the change status button where I could literally change the status of that claim for any particular reason. You want to make sure that when you pull all your claims into this screen, that your EDI receiver is populated correctly. So make sure that you're using your new EDI receivers or EDI receivers that you had before. Make sure that all your EDI claims that have an EDI indicator under media have an EDI receiver. They need to go hand in hand in order for them to go out the door electronically. Okay, so I'm going to hit print send right here, and I'm going to choose electronic. It does not matter what receiver I choose down here, because when you get into revenue management, it's going to pull everybody in that is in a ready to send status. You're including your paper claims, so it'll actually scrub your paper claims as well as your electronic claims. And before I hit that OK button, are there any questions about what I've gone over so far? I'll give you a second to unmute your phones if you have any questions. Oh, okay. All right, so I'm going to go ahead and hit OK. And this is where your lives change drastically. Okay, so now I've got a screen that pops up and doesn't really tell me much at first glance. However, it's telling you quite a bit. So you have, right here is where it's segregating or filtering the screen. So it's sorting the screen by receiver. So my first receiver is always going to be, when it says receiver 1 and there's nothing after it, that means there's no receiver on that particular claim, meaning those are my paper claims. Anytime I see a plus sign in revenue management, it means there's more data. So when I hit this plus sign, I actually see the paper claim that's in a ready to send status. The first column right here is indicating whether I want to send the claim or not. And the box is not checked, and we'll get into a little bit in a minute why that happens and what it's doing. Then I have a plus sign right here that actually shows me all my electronic claims. Okay? I have column headings that I can move around And just like an Excel spreadsheet, I can actually drag and move them. And you've got some things on this screen that you don't typically have in claim management. One of them is you have the full patient name. And if you don't see that on your screen, it's because it's way up here on the right. Okay, but it comes up on the screen as a default. Okay? You also have the diagnosis codes. So you never get to see the diagnosis codes in your regular claim management screen either. So this is kind of like a glorified claim management screen, but it's sorted, and it gives you filter and data items that you didn't have before. Now, any one of these column headings I can click on, and it'll actually sort that area. It'll sort that column. And then if you notice, as I click on these, I get this little box that pops up right here. So I can literally click on this box, and I can filter out any one patient if I want to, just to look at that patient. And any of my column headings will do that. So if I'm a clinic that has had a flu vaccine clinic, and I actually want to look at my particular diagnosis code to make sure that it's all looking okay, I can even filter out my diagnosis codes here. So maybe you have one procedure that you really got to keep an eye on, and that would be a good way to actually filter it. Now, you also see this column called Edit Status, and it says that it's not checked. And that means that your claims have not been scrubbed, and I mean scrubbed for data entry errors. There's many, many edits that take place in the program as a default. Missing member IDs, signature on files not checked, EDI payer IDs missing. It will even scrub for relationship validity, meaning that if I say that this patient is a spouse to the insured, the policyholder, it is going to expect that the policyholder's ID number or chart number is on that patient's account. So when I go over to Medisoft and I look at a particular patient, I edit their case, I have a guarantor chart number right here. And for this patient, it's the same thing. However, under Policy 1, if I put something other than self here, it is going to look for a different chart number on this field. Same thing with your secondary. So if you're getting those errors in your revenue management screen that say the relationship field is invalid, it knows that it's self, spouse, child, and it knows that the chart number is not correct. So you have two choices. You can load everyone as self, and we haven't seen any problems with doing that. People are still getting paid. However, pediatric offices really need to get it straight, and it's really hard to load everyone as self because you actually need the parents' information in the system. So just make sure that those the relationship logic is correct. So if it's self, load the patient themselves. If it's spouse or anything, if it's something other than self, you need to get that guarantor chart number into your system. And yes, that means you're going to be loading patient information for patients that you probably never see, but they're connected to other patients in your system. So pediatric offices are actually very familiar with that process. Mostly all other specialties will actually load everyone as a self. Okay? All right. So a couple of other things on this screen is I have a selection box, I have a save box, cancel, print, check claim, send, and split. My select box is where I would actually come up here and I would choose when I want to send secondary claims. If I do this, primary, secondary, ready to send, it actually changes my sort criteria to my secondary receiver, and it brings in all my secondary claims that are in electronic, that are in a ready to send status. I have some that are actually electronic, I have some that are paper. Anything that is ready to go electronic will actually check the box already. Secondary claims do not need to be scrubbed. They already were scrubbed when they went to the primary. So when you change your filter to secondary, it actually checks the box for you already. So I don't have to check these boxes. And we'll get back to that in just a minute. So I'm going to go back to primary. And I'm going to open up this box right here. Your save button is here because you can change certain parts of this screen. Like I can change this claim to electronic if I want, but if I do that, I need to make sure that I hit save. The save buttons in revenue management actually trigger the system to go back and save things inside the Medisoft program. So there's several different areas of revenue management where you can do updates that you want to hit your save feature, and then it'll actually update your Medisoft. Cancel is just to cancel out of the screen, and your print button we'll go over in just 1 second, and then your check claim we're going to actually cover right now. So your check claims is where you actually scrub your claim. So when I hit check claim, now I made that change right here, so it gave me an error. So it wants me to save my screen, and then I can check my claim. Now, if I do all receivers, it's going to scrub my paper claims for me as well. It may scrub it for electronic processes and stuff like that, but it would still scrub the paper claims in the event there was an error. So I recommend that you do all receivers. And it goes through and it counts through each claim, and it's looking for specific edits. Your revenue management has been customized for your practice, your Medicare carrier, and your specialty. So if you are a podiatrist, it's scrubbing for podiatry services, not for internal medicine and vaccine services. So your services has actually been customized just for your practice. Now, I'm going to sort this. I'm going to bring all my errors to the top. You also have informational errors as well. So you will have green flags, blue flags, red flags, and yellow flags. Green means that they pass, that they're good and ready to go, and those will get checked automatically here. So this check mark tells me that when I hit my send button, it's going to be included in the batch. I also have a plus sign right here telling me I have more data. So now I can see the actual date of service, the CPT code, any payment amount that came along with it, as well as the provider and the place of service. I have a history tab telling me how many times I've checked history and what has occurred when I did that. So you will actually see historically what you've done with that claim. Now on my air claim, or my informational claim, I'll actually have a third tab, and that's my edit tab. So when I click on this, it tells me exactly why it came up as a non-agreeing status. So it's saying that there's a global period with procedure code for that date of service. So when I look at this, it's saying that this is a global procedure to my office visit. Now, the bad thing about the global edit is that it does not see the modifiers at this point. Hopefully, then we'll change that with McKesson, and there'll be an update that will actually help you with your global period charges. But it doesn't see the modifiers at all. So if you know that this is okay, and this edit is just informational, I can actually check this box. Okay? And then let's push the claim through. Same thing with this one. So I'm going to go ahead and check this box. Okay, now I've got all these other errors. And I don't necessarily want to open these up one by one and review the errors. I want to actually see them all in one spot, so I can take care of them all at once. So I'm going to go ahead and I'm going to go up to my print button, and I'm going to print edit. It comes up with the standard report. This is the only report that you can print from the print menu of this area, and you hit OK. Now you get a comprehensive report telling you exactly what is going on with each error that you're getting. Now, I can print this report by hitting one of these print icons up here. And if I hit this button with the question mark, that's actually going to ask me what printer I want it to go to. If I hit this one, it's going to go to my default printer without any question. Okay? I can also come over here and I can send it via email. So if I have an off-site biller that actually handles my errors, I can actually email that to her. It gets emailed to him or her in a PDF format. You can also save the report or export the document to any number of methods. I would encourage you to do PDF because of the way that it's laid out. Okay? I can also click on this magnifying glass, and I can search for certain things in the actual report. Now, the report, the way it's laid out, is it gives you the error and the diagnosis. So here's your error at the top. It will also give you, let me go down here. This is where it starts the section. So you have the actual patient name, their chart number. This is actually their case number and their claim number, as well as their primary insurance, primary receiver, facility, and physician. Then it gives you the errors that it's having, as well as the CPT codes and the dates of service and the facility. So at this point, I have two choices. I can Can you guys mute your phone? The one that's talking about Zoloft? Thank you. Okay. So, at this point, you can print the report. You can work the errors, and I can actually jump over to Medisoft, and I can correct these errors right here on the screen. So I'm going to go over to this one, and it says that, where's that one that had too many diagnoses? Thought I saw one. Let's go to Dana Donald. So with this report open, I can actually go over to Medisoft, and I can go into my transaction screen, and I can start working this error report. Now, I've actually created a edit in my system that tells me if I've got more than 5 diagnosis pointers. The clearinghouse this client works with has an issue when they actually send more than four diagnosis pointers. So I go ahead and I fix my error. I hit save. I can come back to my previous screen. I can actually close this report. I can run my check edits again, and Donald Dana will actually be corrected. This. Maybe it looks like a little. It also has an invalid diagnosis. If this was if the too many diagnosis pointer was the only error, it would actually get rid of that error. So as you can see, the error for the too many diagnoses went away. So I don't have to close out of revenue management and go back to Medisoft and work my stuff and then come through this whole process again. When I close this screen, my checks go away. So when I open up revenue management again, I will need to recheck my claim. So I can leave this open and I can work in Medisoft to get things corrected. The only thing that you can't touch in Medisoft while you have revenue management open is your claim management screen. Your claim management screen is locked, so you can't make adjustments to claim management. But you can make adjustmts to providers, to insurances, transactions, cases, patients, all that good stuff, and it'll actually acknowledge your corrections that you did inside the program. Okay, now if I want to push these claims through, and there are errors that I really don't have a concern with, I can actually check these boxes right here. Now, anywhere inside revenue management, if I want to highlight this, if I want to click on this one and highlight and click on the last one, I held down my shift key. When I clicked on the first one, I held down my shift key and clicked on the last one. And then I could check any one of these boxes, and it would check them all that's highlighted. You can do that about in any part of the revenue management program, and that's going to be a big benefit when we go over the insurance list that I'll show you in a minute. Okay, so I'm going to uncheck these. And I'm going to let these go through, because I know those are okay. So my next step is I'm going to hit send. And I'm going to send my claims, and I'm going to send them one receiver at a time. So if you have multiple receivers in here, you're actually going to send your Medicare separate from your commercial. So I'm going to go ahead and I'm going to hit OK. Because I pushed 2 claims through, it's warning me. You have 2 claims that failed validation. Are you sure you want to send them? I'm going to go ahead and say yes. And then the next step it's doing is it's actually scrubbing the file for file structure. Meaning I'm sending in an ANSI file. It's actually looking to make sure that everything's in the correct place, that anything that's required is present, anything that's not supposed to be there is not there, and everything else is actually going correctly. So now I'm actually looking at my first tab. The tabs are separated by insurance carriers. So if you notice, I've got a Blue Cross tab. Here's another Blue Cross tab, but it's probably a different Blue Cross insurance code or a different provider, because they can be segregated by physician or by insurance. Anything that passed completely for that entire insurance has got a green dot right here. Anything that had an error is going to have a red X. Now, just because I have a red X on this tab does not mean every single one of those claims have a problem. It means that at least one claim on that tab has an error. It tells you exactly what the error is, missing info, or it's missing or invalid for an individual relationship. So that's that relationship that we talked about. And it tells you exactly where it's looking in Medisoft to get that error. So when I have this minimized, I may not see that on the right. So you want to make sure that you scroll over to the right to see where the software is looking that is getting that problem. So I'm going to go ahead and we're going to take care of this RANJE patient. So I'm going to close this. And I'm going to come back over to Medisoft because I want it to rerun when I run it again. JEN campus. So I'm going to check my relationship and policy numbers on my policy 1 and 2. And this all looks good. We are noticing that you may get relationship errors in revenue management for brand new patients if you're using patient quick entry. So what tends to happen is you just need to go into the case, you hit save, and then that error will pop up again. I'm going to save that. And I'm going to go ahead and hit send again. You can see down here that it says please wait. So it's actually scrubbing through the chart numbers. Okay. Oh, I did the wrong page. It's RANJE. Go over here. That all looks good. Try that one more time. Now you see that that patient's actually good to go. Okay, so in this screen, you have an option to hold your rejections back again. So you're holding them back here. Any claims that is in this screen that is in a red flag status stays in claim management and stays in a ready to send status. So those don't ever get put to a set status because they aired out and you held them back. Claims here that I'm actually allowing to go through that have a red dot, those will actually go through, those will eventually get updated to a sent status. If I want to remove all my failed claims and send my good ones, I'm going to go ahead and hit this remove all failed. I can also click here and I can remove just one individual claim if I want to. Before you remove any failed claims, you may want to come up to your report section up here and you may want to print a failed claim report. So it will show you exactly what's going on with the claims in the second level edit. Okay? Now, you may not necessarily have to do that because if I remove these failed claims, they'll actually change to an alert status, and that comment that you see right here will actually get populated on the claim management screen. So I'm going to go ahead and I'm going to remove all my failed claims, and I'm going to go ahead and I'm going to hit send. And depending on how that receiver is set up, it's going to know what to do. So if you're using a clearinghouse, it's going to open up your clearinghouse website. If you're dialing direct to Medicare, it's going to come up with a black screen, and it's actually going to start dialing the phone number for Medicare, and it will actually transmit the file. Medicare direct clients will also, the system will know that the file was sent. It will automatically open up the reports, and it will automatically open up the report area where the reports are downloaded. So I'm going to log into my clearinghouse. I'm going to upload to my clearinghouse like I normally do. The only difference is, actually log into this. I'm going to select my file. Your files have changed. For many of our clients, we've actually put an icon on your desktop so you can actually find your claim files. Others, we've actually instructed you where they go. You basically want to get to your metadata folder, wherever it is on your network. Then you're going to actually open up your RM data folder. This is where all your revenue management data is housed, your reports, your ERAs, your claim files, all that information. You're then going to go to that practice folder name. Sometimes you guys have a data folder, sometimes it's new, sometimes it's actually the physician's name. And then all your claims are actually created in your outbound folder, meaning files going outbound. Anything that you want to download to software or download to your reporting area, such as ERAs or reports, you would log into your clearinghouse website and you would download those files. And we'll go over that in just a minute. So my outbound claims are sitting here. Now, this file is the file that I just created, and I can tell that by the date right here. And I'm going to select this file, and I'm going to upload it. And you're going to get your tracking number that you may want to copy, and you're going to go back over to that RM folder area, and you may actually paste that. Some clients paste the tracking number onto the file itself. Okay, so this is your path right up here for your claim file. Okay. I'm going to go ahead and open it up for questions. Does anybody have questions what we went over so far? Yes.
So under the receivers at the beginning, you know how you said the first one, the receiver with no name attached to it, the paper claims, do all paper claims go in there?
Yes.
Okay.
Now, all paper claims, if they don't have a receiver, sometimes people make a mistake and they add a receiver to the paper claim. So if I look at this one, see this one right here?
Mm-hmm.
That, well, let me see. Let me see if I can make an example here. Hold on a second.
Because I'll need to do one in that receiver one.
Right, and there was other paper claims that were sitting, I think there was two that were actually ready to send. However, the paper claim, this one right here, is Rebecca Rodriguez. That claim is actually a paper claim, but it's got an EDI receiver on it. So I physically just uploaded that claim to that clearinghouse because that EDI receiver was attached. However, it shouldn't have been. So for your paper claims, you shouldn't have an EDI receiver, but many times you make a mistake or your switches things back and forth. So this one is typically paper claims, but it's anybody that doesn't have an EDI receiver.
What's the okay?
Okay, so that's how you, and the majority of the time it is your paper claim. So you'll be able to actually look at these and see which ones are done incorrectly, and you can correct them.
Okay.
Okay, any other questions?
This uploading is only if you don't have the EDI receiver in this this form, right?
When you're uploading, it's when you do have an EDI receiver. When you don't have an EDI receiver, it should be dropped to paper.
Like me, I do the relay health. Do I have to do this uploading? You still have to do the uploading?
No. What I showed you was a clearinghouse process. When you have Relay Health, it functions a lot like Medicare Direct. So when you're a Relay Health client, you hit that final send button, it logs into Relay, it uploads the file, it does all that stuff for you, it downloads your reports. But Relay Health is the only clearinghouse that we do that with. Because Relay Health and McKesson, they're like brothers and sisters. So when McKesson develops software or develops processes in the Medisoft software, it's really designed for Relay Health clients. So things are more streamlined. There's a little bit of a better advantage when you use Relay Health as a clearinghouse than with any other clearinghouse that we work with. So in this example, I use a clearinghouse based out of California. They're an Office Alley clearinghouse, and that's kind of equivalent to Availity, Gateway, EDI, all those kinds of clearinghouses. The process that I just did with Office Alley would be the same. For people with Relay Health, you just hit the send button and it does everything for you. So it grabs the file, it uploads the file, it downloads your reports, it does all that stuff.
Okay.
Okay?
And usually this Availity, Office Alley, these are free, right?
Availity and Office Alley are free. Availity is very big in Texas, Florida, Georgia, out on the East Coast. Office Alley is very popular on the West Coast. However, both clearinghouses will work with all insurances across the nation. So it just kind of depends on what your preferences are and stuff like that. So, and you do get added benefits with a clearinghouse that you pay for, but many of those benefits are benefits that revenue management is actually taking care of for you. So, many of the clearinghouses that you use today scrub your claims for you where your software is doing it for you already. So the main difference between Availity and Office Alley is Office Alley actually has an online claim fix. So you can actually go onto their website, see what your claims did. Anything that didn't pass their edit, go into a claim fix area where you can fix them online and you can push them through. Availity doesn't have that feature. They actually make you resubmit the claim with the corrected information. So some people like it one way, some people like it a different way. So Relay doesn't have that feature though either. So.
Right. Okay. So if you don't want to do all these steps, just go with the Relay Health.
Yep, that's pretty much the right answer, yeah. Eventually, we'd like to have some scripts written to where you go to Office Alley or you go to Alien or you go to one of these major clearinghouses. It actually logs into the site for you and grabs the actual file. But that is dependent on JV medical staff actually writing the script for that because McKesson will not do that. And right now, with all the 50-10 craziness going on, we just do not have the time at the moment. So eventually, when things calm down, hopefully we'll be able to get that squared away with Office Alley and Availity. Okay? And Gateway, the major one. All right. So, any other questions?
Shauna, one more question. Going back to the report, now if you just view the error report, does a copy of that error report go automatically into archive, or do you have to actually push print in order for that report to be sent to archive?
This report right here that you hit from the print menu, the very first error report that you get, does not go into archive. Any other report inside revenue management does. So any reports that you receive through your clearinghouse or the second level error report, that actually does. So, but this very first one doesn't. So if you want to print your errors, you need to print them at that time.
Okay.
Okay? Any other questions? Okay. All right. So
if you have a patient, if you have a payment that is not paid, and you want to find out what is the error, you missed all these corrections. How can you do that? You just go to the medical, to the Medisoft, and you see there's a patient that was not paid, and you don't know what was the reason. How do you find out why it was not paid?
You typically have to call the insurance company, but sometimes when you do, I think it's actually doing a rejection on the Medisoft screening. check that, because when you post that payment electronically and that payment was denied, the system can be triggered that when it's denied, it goes into a rejected status here rather than a done status, and then you can actually work it from there, and it may even put a comment right here. So see how you have an alert? This is a claim that aired out on the second level, and it got removed as a failed claim. And then right here is the comment that tells you what the error was. So any claims that go on to the second level where it's giving you loops and segments that are the errors, and you remove them, so when you either hit remove all failed claims or you hit the remove claim, it will actually come over here and it will change it to an alert. So you'll see the error right here. However, with a denial that has come through and it didn't get paid, it may change it to a rejected here, and their comment might be right here. So, and then that denial would actually be posted to the account, so you can backtrack the check number, find the check, and figure out what is the reason why for it.
But the most that we see is the denial is because it was not transmitted. It has go to the insurance company. The most that we saw is that it was not accepted by the insurance company.
So it was never taken out of Medisoft and put into your clearinghouse? Then if it was never taken out of Medisoft, it should be in a ready to send status where you can scrub it again and you would see the error again. Or it's going to be an alert status and it's going to have a comment here. So if you want to know what caused it not to go through, you're going to do one of those two things. So either it's sitting in a ready to send because it aired out on the first level, and you're going to run them through the edits again, and then it's going to tell you what exactly was wrong with the claim. If it aired out on the second level and got removed, it's in an alert status. So filter out using your list only and claim management, look at your alerts and read these comments right here on this note. And then you'll be able to see what caused it to err. Now, if you pass them through on the second level and you set them through with an error anyway, I believe they go in the batch, and I haven't been able to actually sit down and really look to make sure, to follow it through the whole process to make sure it went. But I believe it still puts it in alert status, letting you know that it wasn't a smooth claim. And it may have been actually processed and paid, but the file structure according to Medisoft was not correct, and it gave it an alert. So look at your notes right here for your second level edit error, because it'll tell you exactly what's wrong and what it found the problem with. The second level alerts are there because it's trying to tell you that if you let those pass through, your entire file has the risk of being rejected. Because some of those alerts that you get at the second level can cause the entire file to reject. Others, not so much. So it's trying to warn you. You should never just bypass your errors and let your files go through. Unless it's something that's blatant. You know, the flu vaccine codes, the Q codes that were released at the end of last year, those aren't updated in revenue management, so you're constantly getting an error for the Q codes. But you know those are fine. Those make sense to pass through. But it shouldn't air out somewhere else as well. So if it's airing out for another reason at the second level, you really need to look at those errors. The biggest mistake that people make when it comes to revenue management is they just bypass that. They don't really read it. They don't really pay attention to it. It's almost like it's trying to give you advice, and you're ignoring that advice. And then you wonder why your revenue's down or why your claims aren't going through. Always pay attention to the errors it's giving you, because it's giving it to you for a reason. It's trying to help you make your claims clean. So let it do that and pay attention to that and really read the errors and do the adjustments. Now, there are rare occasions like that relationship for a new patient that happens, and eventually those will be rectified and fixed. But we can pretty much narrow it down that it's typically when people are using patient quick entry, and it's not like completely finishing the save process for that patient. So we know how to get around it, and we know which ones you want to bypass. But for the majority of the errors, you really want to listen to them and you want to read them. Okay? Did that answer your question, Dr. Cornett?
Yes.
Okay. All right. Any answer?
Those CVI, the receiver, the 5010, and there's still insurance that gets the 4010, right?
Right. And you need to check with your clearinghouse to make sure they're doing what you need them to do. Most clearinghouses are actually, you can send them a 4010 file, or you can send them a 5010 file, and they're converting the files for you to whatever they need to do for that particular insurance. But I need you to check with your clearinghouse and have them give you direction as to what they want to do. For the most part, you should be able to send one file format up to your clearinghouse, and they can adjust the file when they need to for Aetna or Blue Cross or Medicaid or Medicare. So like Medi-Cal, California, they can't take 5010 files for another year. But clearinghouses in California are actually down converting those 5010 files to 4010 for that payer. So check with your clearinghouses to make sure they're doing what they need to do. Okay? Any other questions? All right. So I went ahead and I submitted my batch, and then it asked me a question. It says, were the claims transmitted successfully? If you are not submitting direct to Medicare and you are not using Relay Health, you will get this box. If you're using Relay Health or Medicare, the system knows the file transmitted successfully. It doesn't even ask you this question. So when I hit yes, that triggers the system to give me a report showing me what was transmitted, as well as open up my reporting software where I can download my reports, or I can look at the reports that were already downloaded through the automated process. Medicare and Relay Health will download the reports automatically for you. And it will download your ERAs, your acknowledgments, your status reports, all that good stuff. Okay? So I'm going to minimize this for just 1 second. And you'll notice that this is blank, because these were the ones that I removed from the batch. It's just giving me a copy of that other screen showing me what I transmitted. So at the very top on the right, I see that I transmitted 3 claims for $1,400. This is the number you want to pay attention to, because that's the number that my clearinghouse should be giving me when they acknowledge they got my file. Okay? This report, you can print it. This is the one you don't have to worry about printing because it actually gets archived for you. So, and I'll show you where those archive files are at. Okay, so you can print this, you can send this to a doctor, you can actually review this at any time. So I'm going to go ahead and close this. And one thing that the reports do in revenue management is they put everything in a PDF file that you would actually go back to and review. One of the worst things about Medisoft in previous versions is it would do all this reporting stuff, but the reports could only be viewed in Medisoft. So when I had a physician that I wanted to give my status report to, and I wanted to send him a report, I'd send him a report. He couldn't actually see it. I would have to do an actual Medisoft report in order for him to be able to see it. All the reports, the error reports, the transmission reports, those are all in PDF, so everybody can actually see them. All right, so now I'm going to go ahead. Once I've transmitted my claims, I'm going to go ahead and close out backwards. So this I'm going to close. I'm going to go ahead and close out my revenue management here and my revenue management there. I'm left with my reporting menu open. Once I do that, it actually shows me what it did. So here's my alert claims that I had a problem with. And when I right-click right here, I can look at notes. And it actually gives me that same red error that I got. Okay, so it's telling me that my relationship was invalid and this claim did not go through. It also gives me a date and time that it was done. Okay, so when I'm wanting to work my claims, I want to work my alerts. So these alerts I actually want to take care of. You will also get alerts for secondaries. So when I send my secondary claims, I can right-click here, go to notes. And it was missing a payer ID for my secondary insurance, so it didn't actually go through. Okay? The other thing that you may want to work are rejected. These are ones that were actually rejected because when the payment came through, it was a zero payment. So I'm going to right-click here, look at my notes, and here I've got my ICN number, so that's the claim number that the insurance company gave it. And then I also come down here and I get some other errors. So I'm missing an admission date. Gives me all kinds of stuff that's wrong. Okay? So your software is actually working for you instead of against you. So now I actually see these ones that were rejected. Okay? So I imagine this didn't pay because there was an admission date missing. and I may have pushed it on through, and now I've got this error that came back with the denial. Okay? All right, so there's that. So it updates your Medisoft. Go ahead and go to all here.
I'm sorry, Shauna.
Go ahead.
The rejections came back from the insurance?
Yeah, so when the claim went out and it got processed by the insurance company, they sent back an ERA or a EOB, and we posted that ERA electronically, and I'll show you that process in a moment. But when the payment came back, these ones that are rejected were denied. So in other words, your rejected claims are denied claims. So these are claims that had a denial. And I could tell what the denial most likely was. And this one's blank.
And that came back electronic from,
yes.
Okay.
Yeah. Now this one doesn't have a denial. So this one, it does give me the ICN number, and it wasn't a paid claim. It was a denied claim. So it doesn't put it in a done status, which is good, because I don't want my zero payments coming through and just getting pushed under the rug and me not knowing that they were denied. So, and then they're marked done, they're taken off the aging reports and stuff like that. So these can actually be put into your claims collection list area for someone to work for you. And then let's look at this bottom one. This one actually had errors going out. It was probably tagged as an alert, but we pushed it through anyway, and when it came back with some denials here. So these are some things that happened back in July, but here's the actual claim number that actually got pushed through the process. So this is a perfect example of somebody ignoring the flag and letting it go through anyway, and now it didn't get paid. So this is what happened with the claim all the way through, and now I've got an ICN number where I can call the insurance company, which would be Medicare, and I can give them that number, and I can ask them what's going on with the claim and what happened, or I can search my online tool or whatever. Okay? So yeah, the rejections are coming back for payment. Alerts are being tagged that way from the claim process going out. And any one of those is going to put a little note right here on the left. Okay?
And the rejection status, we put that on. We changed that from sent to rejection.
No, the software does it itself. The software does it itself. So when the EOB has a zero payment, it's actually triggered in the software to tell it that when I have a zero payment, when I have a denied claim, I want it to be in a rejected status. So your denied claims do not get put in done. They get put in rejected when you post the EOB. Okay?
Okay.
Any other questions?
Okay. What clearinghouse automatically sends reports?
Relay Health and your Medicare carriers when you dial direct. Now, if you're submitting your Medicare to a clearinghouse, you're not going to have that automated process. If you're actually using a dial-up connection and you're dialing directly into the Medicare, then you're actually going to get those directly. And dial-up can be pretty problematic. So, okay. So, for those people that are using clearinghouses, I'm going to minimize this for just a second. I'm going to go out to my Office Alley account. I have a download file EOB. You may have a reporting area where you would download files as well. And you have Office Alley, the way it works is you have days where you actually download your EOB. So I'm going to actually get to my EOB file and I'm going to hit View. Availability has an area where it says download options. You click on it and you actually download or save the file. So you're going to save the file and you're going to go back to that metadata folder or MData, the practice name, and you're going to put it in your download folder. So when I put it in my download folder, it is actually going to, and if you notice, this is a zip file. So once I put it in the download folder, it's actually going to unzip the file. It's going to move my 835 file that's inside this zip file, and it's going to put it in my report folder. Office Alley gives you two reports. They give you a text report, and they give you an actual ANSI file. So it's going to unzip the file. It's going to move the text file and the ANSI file over into the report area. It's also, once you post it, it's actually going to put another copy of it in a different area. So for those folks that are using EasyPrint, it's actually going to put it in an MREP folder. So if you notice, under my RM data, or under my metadata, I have an MREP file folder right here. When I post my EOB, it actually takes a copy of that file and it puts it there so that I can import it into EasyPrint if I need to use EasyPrint. Okay, so I'm going to hit cancel there. We've actually already done that. Now, this reporting area actually opened up when I had transmitted my files. It actually looks like this. So my reporting area opened up and it automatically started looking in that download folder in my report folder for reports. It brings them into this area. So here's those text files that came in with the check. And then here's my actual payment. All payments show an 835 on the left. If it's an acknowledgement report of some kind, it'll typically have 277, a 999, a 997, a TA1. It'll have certain numbers over here that tell you those are acknowledgement reports. Every clearinghouse can look a little bit different, so it just depends on who you're working with and what it looks like when it comes in. Now, the way I've got this set up, or the way this client has it set up, is this client's a billing service. And when you're a billing service, you deal with multiple different practices all day long. And you don't want to have to download your reports from your clearinghouse to all these different file folders. So when you're a clearinghouse, you actually download your reports to your metadata folder, your RM data folder, and your download folder. You don't do them to a specific practice. You do them all in that one download area. And again, that was metadata, RM data, download. Once you do it there, it will actually bring all your reports into one reporting area. So no matter what practice you open, you'll see everyone's reports. So this particular client is actually seeing all their reports in one area. They're in this doctor's practice, so they're going to handle those reports for that practice at that time. Once they actually take care of those reports, it'll archive the report and then it disappears. So you want to actually make your report area pretty clean. Once you posted something or reviewed something, you're going to go ahead and close it, and it should archive it, and it will disappear from this area. Okay? So as you can see, I've got two reports right here, and they have the same check number. So these actually got downloaded twice in error. So if I go back over to my Windows Explorer, I go back to my metadata folder, and I go to my RM data. Remember, I downloaded my reports to a download folder because I'm a billing service. It converted things and moved it over to my report folder here. Once it goes out of the download folder, my download folder is empty, so it stays clean. My report folder is an exact replica of what is in my report area right here. So I've got the same check listed twice. I can tell that there's the same check number by the file size right here. So I'm going to actually delete this. And if you notice, it deleted it out of here. So these two are interconnected. You should never put anything directly in your report folder. If you ever want to download reports, download them to your download folder and let them convert, because the system does something specific to it to know what it is. So, and then I have another one right here, the 55 one. These are two text files that are the same. I can see they're the same number. So I'm actually